moving on to the main event, which is the report on Arpa proposals from the Brookline Community Foundation. So I will turn it over to Giselle.
The main event. I feel there's a lot of pressure here. Hi everyone. I am coming to you live from my daughter's room. In crossing my fingers, she won't barge in during this presentation. But thank you so much for having me tonight. And I'm also joined by one of my colleagues, Marianne, who won't be on video, but she will be sharing her screen as I walk through sort of the presentation. I think you've set aside maybe 45 minutes. I just want to share, the report is long. The report is long, many pages, very detailed, really robust information that we've gathered from the community. And so this presentation really hopefully is meant to be an overview, but I want to just warn you, there is going to be a lot of information coming at you, both qualitative and quantitative. So Marianne, actually, if you could, start sharing your screen. And I should say, I'll walk through an agenda as well, so that you all know what I'll be covering. And I'm hopeful that you can hold questions until the end, unless they're clarifying questions. And so I think, let's sort of play it by ear. But I think this will be a pretty comprehensive presentation. So let's get started. Marianne, next slide. All right, so this is the agenda for the presentation tonight. I'll walk through, of course, a really quick summary of the project. And again, the report will be submitted to you all, Select Board, Town of Brookline, as well as published for the community later this week. Thankfully, I think tonight's presentation will be hopefully shorter, and it will really just be an overview of all the incredible detail in there. After talking through the project summary, I'm going to do a very quick overview on the community engagement work, go through and talk a little bit on the qualitative data that we received from both listening sessions and focus groups, and then go into the actual survey data. We'll walk through how the community ranked the eligible use categories, and then we'll actually also go into subcategories, and we'll see how the community prioritized sample investments or initiatives within the eligible use categories. And then finally, I will share some recommendations for ARPA funding based on what we've sort of both learned through the qualitative and quantitative data. All right, next slide. Next slide. All right, so as you all know, we partnered with the town of Brookline on a community engagement process to ensure that ARPA funding investments achieve the highest level of positive and equitable impact for the community. We had a main objective, which was to gather community-wide input to help inform ARPA funding investments for an equitable recovery. And we did this by surfacing which of the eligible use ARPA funding categories and the types of investments within those categories are a priority for community members in our town. And a little bit about our methodology. We again had qualitative, quantitative data that we gathered through listening sessions, through focus groups, as well as an online survey. Next slide. All right, I'll do a little bit of just an overview of the actual engagement activity. Next slide. Okay, so the community engagement process entailed, and when I actually counted the weeks, I was surprised and really pleased that it was a 20-week process of outreach and collecting feedback from community members in the town. This was also an effort to integrate community voices into Brookline's recovery from COVID. Voices, I should say, that are typically underrepresented in our town and don't play a role in decision-making. Not coincidentally, those voices are more likely than not from people and groups that have been the hardest hit in our community. We also invited organizations and groups that reflected the diversity of the communities most impacted, with strong grassroots reach and with the ability to connect with the hardest hit community members. we designed what I hope is a replicable community engagement model for seeking community input that would build on assets, strength, and resilience in our community, and hopefully would set a precedent for future planning. When designed, I think you all sort of reviewed the proposal back in early September. The plan included approximately 8 engagement opportunities across the community with various formats like informational and listening sessions, focus groups, and a community charrette. We ended up executing 20 engagement opportunities via listening sessions, focus groups, and an online survey. And unfortunately, as you all know, we were unable to execute the community charrette. And then one other thing I wanted to share about the process is at the beginning of the planning process, we identified a few key principles of engagement to foster both transparency and inclusion. These principles include sharing high-level goals of the engagement effort at every single event, being really, really, really clear about the role that BCF plays as a convener and facilitator, and the role that the town of Brookline and the select board play as decision makers in the funding decisions. We also were really intentional about collaborating with organizations that the community already trusts, creating multilingual materials where possible, making sure that all voices were heard in each of those sort of listening sessions and focus groups. And I think, the most important, I think, is just listening to what our community members were saying. Next slide. Okay, so those were 20 engagement events that we hosted, which were virtual, in person, and online. Those events were through, again, as I was mentioning, listening sessions and focus groups. We also fielded an online survey that had 438 respondents. And in total, we had about almost exactly 728 instances of participation. And I just want to clarify what that means is there might have been community members that both took the survey and attended a focus group and or listening session. So there were some crossover, but not in all 3 groups. So participation instances is how we sort of counted that. Next slide. All right, so I'm going to do a little bit of a deep dive on the listening sessions and the focus groups. And this was a part where there's just so much rich data that we have, and it's data coming directly from people, their voices, their reflections. And so it took a while to really think for the BCF team to look at all of this data, and we sort of sorted it thematically. And so the next set of slides is a little dense, but hopefully not too dense, and really gives you thematically sort of the qualitative data that we gathered. Next slide. So as I mentioned, 4 listening sessions, 15 focus groups. Within those 2 types of events, we had 290 participants. And just this slide, what it shows you is the dates of all of those engagement opportunities. The listening sessions had about 25 to 40 people on average, just depended on the time of day. The focus groups brought much smaller groups of people together, anywhere from 4 to 15. We put a lot of effort into the focus groups because they can be so helpful in situations where I think creative solutions and rapid feedback are needed. And especially we felt that they would serve as a good complement to the other more quantitative data that sort of data collection like the online survey. I should also say that for those focus groups, BCF created a focus group guide and script. And so generally, all focus groups were conducted similarly, both format-wise as well as the questions that were asked. And we also provided community members who participated in the focus groups with stipends of $30 per person, whether they attended virtually or in person. And where we were able to, when those focus groups were taking place in person, we also provided food. Okay, next slide. All right, so The attendees in the listening sessions and focus groups were asked a series of open-ended questions. The responses were reviewed, categorized, and sort of summarized by the BCF team. So the first question was, who in town at the individual level has been most impacted by COVID-19 and how? And so here are the themes that surfaced. While I would say, while it would be difficult to find people not impacted by COVID-19 in some way, the groups below were identified as having been the most impacted in Brookline. So the first group is children and youth. Folks mentioned that this particular group experienced isolation, decreased interaction with peers, impacts on social emotional learning and skills, and challenges around remote learning, possibly also impacting student engagement and academic outcomes. Those students with families living on low or limited resources have been impacted more and have experienced increased food insecurity, issues with access to technology or reliable Wi-Fi, and a lack of support services. And I think I just want to pause for a second, because what I'll be sharing across these next set of slides and even around the online data, that is information that community members sort of shared that they experienced or that they saw others experience. So in no way did I take any of this information and check it across data, right? And so this is really just presenting to you what community members are saying. The next group that folks said were most impacted were individuals and families living on low or limited income. And so these folks have experienced exacerbated inequities, including food insecurity, isolation, trouble paying housing costs, mental health concerns, lack of access to mental health care, and lack of access to reliable and affordable childcare. The next group is older adults. They were impacted physically, mentally, and socially. This group experienced isolation, higher risks of severe illness from COVID-19, inability to go outside, lack of available or accessible transportation, decreased access to medical care, issues with access to technology and reliable Wi-Fi, and limited familiarity with digital technology. The next group is people living in public housing and in group settings. And so folks shared that this group have been among the most impacted, with many experiencing, again, sort of similar trends: isolation, low or little ability to work remotely, unreliable access to Wi-Fi, job or income loss. And the last group that was elevated was the small business community, with experiencing widespread disruption, increased costs of COVID-19 mitigation strategies, temporary or permanent closures, employee health concerns, reductions in workforce staffing, and with some experiencing reduction in or disruption in supply chains. And so these are the sort of the themes and groups that rose to the top across all of those sort of listening sessions and focus groups. I'm going to keep going on the next set of questions. All right, next slide. Great. So the next question was, what systems, institutions, and organizations in town have been the most impacted? So same question as the one before, but instead of individuals, systems, institutions, or organizations. Responses to this question varied, of course, and after grouping them thematically, the following are the broad categories. The first category are nonprofits, which were highlighted for their ability to provide services and supports for community members, including vulnerable populations. Community members recognize that many organizations are operating on limited budgets while demand for their services and programs have increased. And some non-formal 501c3s were also recognized for doing great community organizing work with severe budget constraints. Now, the next set is within still nonprofits, but there were a handful. There were a handful of organizations that were frequently mentioned, and they include the Brookline Housing Authority, the Brookline Food Pantry, the Senior Center, and Steps to Success. Now, a lot of organizations were mentioned, but I'm elevating a few that consistently came up in almost every conversation. All of these organizations were generally praised for their work, and funding and staffing constraints were identified. The next broad category was childcare programs and facilities. These were identified as having been highly impacted during the pandemic. The lack of reliable and affordable childcare programs for children in Brookline was cited as having wide-reaching implications. And then the next set, which you should all be very familiar with, is the Town of Brookline departments. They were identified as generally being understaffed and underfunded. Community members identified a lack of town-provided services and a non-existent social services department. Departments that people mentioned more frequently include the public schools with rising COVID-related costs, Brookline Parks and Open Space, understaffed and underfunded, Brookline Public Health Department, underfunded and understaffed without many key positions filled. Next slide. All right, the next question was, what suffering in our community was directly caused by the COVID-19 pandemic, and what was pre-existing that was exacerbated by the pandemic? While community members were able to separate generally what suffering was directly caused versus what was pre-existing, it was also acknowledged that so much of this is interconnected. So as I share, they're just going to be overall themes as experienced by our community members. So the first one is around housing. So a lack of affordable housing was cited as a significant problem pre-pandemic, and during the pandemic, it was identified as an even more dangerous and precarious situation for families. The second is healthcare. Even among the insured, many people lost access to medical care and were unable to access preventative or sick care or go to hospitals. Demand for mental health services and supports has increased, especially for youth and older adults. And this is one theme that I think I certainly heard and read throughout, where, these sort of categories of vulnerable populations, youth and older adults often were sort of facing the same issues, but a different spectrum. The next category is employment in the labor market. The pandemic had a significant effect on the labor market. The majority of jobs lost were in industries that pay low average wages, and persons employed in the food industry, retail services, leisure, hospitality sectors were among some of the highest unemployment rates throughout. And then we also heard themes around the education and government sector also as having shown great losses. Three more categories here. The next one is secondary education and higher education. So community members noted that education and opportunity gaps widened. Also that college enrollment has declined. The next category is food insecurity. I think just plainly stated, this is increased for more people in our community and continues to be a high need. And then the last category, which was sort of interesting, is more around the group. And so folks really highlighted impacted communities being at greater risk. And so although all groups were affected, respondents noted that persons identifying as Black or Latinx and younger workers generally experienced the most challenges, and that people with lower educational attainment generally experienced higher unemployment rates throughout the pandemic. All right, I think I have two more questions here. This one is, are there specific investments that would focus support on those who've been disproportionately impacted? And what are your ideas for using one-time funds in transformational ways that address the impacts of COVID and contribute to an equitable recovery? So these were actually two different questions, but they sort of got at the same answers, which is what investments would community members sort of elevate. And I'll run through community members' responses again, thematically, and in some cases, share ideas. The first type of investments are direct cash assistance. For example, cash assistance for impacted communities like BIPOC, low-income families, older adults, or single parents, support for frontline workers, and investments in a small business fund. So that's all under sort of direct cash assistance. The next type of investment is climate action investments. And so we heard a variety of examples around grants or loan programs for homeowners to make their homes fossil fuel free. And I'll share a little bit more when we get to the online data, a little bit more on the examples on this category. The next type of investment is education. Investments shared were things like universal childcare, investments to close racial ethnic disparities in education, support for impacted groups, again, BIPOC, essential workers, or older adults who might have experienced limited access to educational opportunities, recreation programs, after-school programs. I'm sorry, the reason it's just so much information, and I hope you're just sticking with me here. Investments in essential needs is the next type of investment. So for example, food access programs. The next one is investments in housing. So development of more affordable housing for low and moderate income residents, home ownership programs, opportunities for lower income households that allow people to build wealth through property ownership, repairing and refurbishing public housing units, housing vouchers, rewriting zoning bylaws, rental relief programs. There were a lot of ideas shared under this category. The next investment would be in mental health program and services. We'll go to the next one, Marianne. Investment in public spaces. So in green spaces, rec facilities, creation of a community center, outdoor public restrooms with hand washing stations, for example. The next investment category, and I think there's this one and another one, public broadband and broadband access and technology training, and especially for specific populations such as older adults and people living in public housing. And the last investment category is around transportation. So improving the conditions of bike lanes, T-passes for METCO students, for frontline workers, residents of public housing, transportation for older adults to travel to and from medical appointments. And so there were a lot of investment ideas. These are sort of the high level broad categories of those. And then the last question that we asked is, what would be different in 3 years, 5 years, 10 years if we as a community invest this funding well? I'm not going to read through every bullet, but I would like you all to just sort of take a moment and sit with these answers, because I think these are the answers to what looks different via this investment in our community. Okay. So hopefully you were able to sort of hear opportunities for impact. This next slide, again, I'm not going to read this one, but we've already as a team, and certainly I've thought a lot about learnings from the process. I've highlighted a few of the things that I think worked really well, and I might just elevate a couple. The first one, and I think the most important one from my perspective, was alignment on shared outcomes with the town of Brookline and select board during the planning process. So really understanding what was a win for this, and what does winning look like for this engagement process? What are we really aiming for was incredibly important. The other one that I would say is working with community partners and community members, right? People who have established trust in the community. And so what that created is BCF didn't have to do all of this work on our own. We were really working with and through others to be able to really run a more comprehensive program. And maybe just one other thing that I think highlights some feedback that we heard, in many of the listening sessions and focus groups, there were community members really being skeptical about the process. Does my voice really matter? Even if I share what I think, will anyone hear it? And then even if they hear it, will investments be made based on, what I'm saying? And so I think, this last bullet around really feeling like one of the roles that we BCF had in this process is reassuring people that their opinions mattered and that it would be valued by us and that we would share it widely in the community. And so that felt really important to share. Okay, I'm going to pause there because the next set of slides is about the online survey, and we're going to be looking at data and graphs. So I just want to know if there's any sort of clarifying questions from this part so far before I move on to the online survey.
So I'll encourage our select board members to use the hand raise feature since we're in presentation mode. You actually addressed the one question that I had, which was, was this perception of reality of others, or, was it direct experience? So I really appreciate that you clarified that when you did. John? You'll have to unmute.
Thank you. Here I am again. Giselle, thank you so much. Brookline has been so fortunate in having you guide this process. So I don't want to embarrass you, and I could, believe me, if I went on and on. But I did witness several of the sessions, and now I'm learning more based on this excellent report. The one thing that the first question that occurred to me as I was listening to this report and experiencing so many things that I have heard mentioned in so many other contexts as needs in the community. And I keep wanting to sort of get a sense of what part of this maybe surprised you the most. What is the aspect of this that is the most revelatory and new that maybe we didn't know before this process was undertaken?
And this is not because I know everything, it's because I've been listening to a lot of community members since I took on the role. And so anyway, the answer is not a lot of this surprised me. And I think in the first 4 or 5 months in 2020, so I started the role in a pandemic, and I probably talked to 300 community members and asked just general questions. And so I think what, sort of you're also saying is when you're having conversations with people, whether it's a specific question about ARPA or a broad question around how are you experiencing Brookline, I want to learn, all of this just comes and bubbles up to the surface. So it's not surprising. I think the one thing, or if I were to name one thing that did surprise me, is the lack of, and I'll speak also for BCF, the lack of intentional community engagement that we do as a town is surprising. Because, when we first sort of, this opportunity presented itself to us, we thought, okay, let's run this, let's see how this goes. And it's sort of, we just designed a process and then executed it. So while it was time consuming, it was a great effort, and it was us with a lot of other partners. It was just surprising that this kind of engagement hasn't typically happened before. And I think that led to a lot of that feedback around, okay, fine, I'll share, but it's not going to make a difference because I don't know, because this doesn't typically happen. So as a community foundation, I think that was hard to hear, but a really good experience and a great learning.
Great, thank you. Any other questions from select board members? I think we can go into the survey then.
Let's do it. Next slide. All right, so just adjust my screen. All right, so we fielded an online survey for about a month, December 2nd through January 4th. The survey was made available in 5 languages: English, Russian, Spanish, simplified Chinese, and traditional Chinese. We invited community members to fill out 7 questions plus demographic information questions, which were optional. Most of the questions were formatted as select all to ensure that we would receive a comprehensive range of responses, so that participants would be limited in their choices. Survey respondents must have had a connection to the town of Brookline, and those who replied that they did not have a connection and didn't indicate their connection were discarded and eliminated from the data analysis. And then the responses were reviewed and analyzed by our survey consultant. And I do want to say, we did not develop this survey. We hired a consultant. This is an art and a science, and we're very lucky that we were able to subcontract for this. Next slide. Okay, so 438 completed survey responses, which is, I learned, above the number of responses needed to ensure that our survey was reliable and statistically significant. I believe the survey consultant said 400 was a good number, and we got 438. So we do feel that these results are a good representation, representative sampling of our community members' priorities. Approximately 84% of respondents indicated they are Brookline residents, while 16% of respondents indicated they were non-residents with another connection to the town. So either you have a student in Brookline, you work in Brookline, or you own a business in Brookline. And then you can also see the distribution across the neighborhoods and the zip codes. Next slide. All right, I'll walk us through this, but it's important because I want you to know who is answering these questions. These are the demographic questions, optional, but we had a good number of people fill them out. And so the data that I'm going to share with you is for those who did fill these demographic questions out. And they could have chosen which of these questions to answer. So they could have chosen to answer the age one, but not the income one. All right, so for age, people age 65 or older were our largest age category at 32%. Respondents between the ages of 35 to 64 made up about 49% of the pool. In terms of gender, far more women filled out the survey than any other gender. We had 5% of respondents identify as Latinx or Hispanic. In terms of race, in some instances, when you look at the racial breakdown of respondents, the demographic breakdown of respondents or the racial breakdown of participants is fairly representative of Brookline's racial profile, according to the 2020 census data. And so, for example, white, Black, and Latino Hispanic, those percentages are roughly pretty similar to our town's racial demographics. But just remember that in every single one of these categories, we had respondents who answered that they preferred not to share or left it blank. In total, we had 74 respondents who identified as people of color. So whether they identified as Black, Asian, multiracial, or Latinx or Hispanic. So that's approximately 17% of respondents. Marital status, 63% of participants indicated they were either married or in a domestic partnership. 31% indicated that they had a child under 18 in the household. In terms of employment, of those who chose to respond to this question, 55% were either employed either full-time or part-time, 24% are retired, 3% unemployed, 3% working without pay. So for example, a caregiver. Essential workers, we actually had among those who are employed and self-employed, 31% indicated they were essential workers. Household income, of the participants who shared their household income, 11% are living on income below 50,000. 20% are living on income between 50 and short of 100,000, and 41% are living on income above 100,000. So this question, not surprisingly, had the highest number of people preferring not to share. So our N there, I don't know if it tells us, it doesn't. Okay, so for home ownership status, again, of those who responded to this question, 69% owned their home, 20% rent. And among the respondents who indicated that they were renters or chose other or preferred not to share in the home ownership status question, 12% indicated they live in public housing. Okay, so those are the demographics. We're going to move forward to talk about how our respondents, so the 438 people, ranked the eligible use categories. Next slide. And just a very quick reminder, these are the eligible use categories. These are not the rankings. And I just wanted to make note that for this survey, we chose to separate out support for public health response, negative economic impacts, and equity-focused services. All of these are part of category A, but it is the broadest category, and we really wanted to see how people responded to these types of distinct investments within the very broad category. Premium pay for, and then just the other thing to note is for category C, revenue loss and government services, we did not make that category a part of the survey. So you won't see that in any of the data. And mainly because, this category will be done via the formula provided in the guidelines. Okay. All right, so here are the overall rankings. It's important to note that category A was by far the top ranked overall category, but within the distinctions that we provided, we see sort of more discrete ranking. So support for public health, and the way that you read these, and I'll just quickly share the way that you should read it, take support for public health response number one. If you read it horizontally, 38% of respondents chose this or ranked this as their number one. 20% ranked it as their number two, 17 as their number three, and so on and so forth. And so these rankings are weighted. So support for public health response was ranked in the number one category. I should say in the survey consultant, made a point to stress this, that the survey was fielded between December 2nd and January 4th, which of course coincided with the spike in COVID-19 cases due to the holidays and the Omicron variant. And this likely played a role in driving that number one ranking of support for public health response to the top. The second ranked category was equity-focused services, coming in at number two, and negative economic impacts in the third spot. Also not surprising, since many of these issues existed pre-pandemic and were exacerbated. Premium pay for essential workers at number four, and investments in water, sewer, and broadband in number five. And I mentioned that the results are weighted, so I'll just give you a very quick example of that. If you look at addressing negative economic impacts at number three, 27% of people chose this as their number two category. But because 29% of people chose equity-focused services in their number one spot, that put equity-focused services above addressing negative economic impacts because these were weighted. And just again, a reminder that we chose to separate out category A into three distinct areas, and those are your 1, 2, and 3 rankings, right? So I think if we had collapsed all three, it's clear to me that category A would be overwhelmingly on top, with more than 80% of respondents ranking that as their top category above the other two. But again, this is because we wanted distinct, sort of discrete information. Okay, next slide. We'll go into, and sorry, I want to pause here for a second and just check on time. I know we're running behind, but I just want to get a sense.
You're keeping a very good pace.
Okay. Okay. Great.
So I think you had 44 slides total. How many slides are you on?
I think we just need about 11 more.
Great. Okay.
Okay.
Do what you must.
Okay.
And we'll open it up to a discussion by the select board.
Okay. All right. So next slide. All right. So these, use your glasses if you have them. I will walk us through as best I can. For each eligible use category, we asked people, so the question is the same: which examples do you believe would make the best use of ARPA funds for the following category? And then we just plugged in the different categories and gave examples that people can select all if they wanted to, or select one, or select none. So people could make decisions as to how many they could select. And the top part of this slide, that's what the examples were, and the percentage of people that chose that or that selected that example. And the bottom part of this slide is, you'll notice that we cut the data by key impacted groups. So those groups are those 65 and older, females, people of color, so Hispanic, Black, or Asian, lower household income, essential workers, parents, and non-homeowners. So for any of these questions, you'll see how those key impacted groups answered. Okay, so the majority of respondents, as you see, chose stop the spread efforts within this category as the top use of fund. That's 66% of respondents chose that. And if you notice these first sort of bars all the way on the left-hand side, all key impacted groups chose this answer at higher rates than any other use category that we presented as an example here. So this was clear. Stop the spread came in at the top, with crisis intervention services to address emergency mental, emotional, physical, and behavioral distress coming in at number 2 at 54%. So 54% of respondents selected this. I should just make note that lower household income respondents chose crisis intervention at higher rates than other key impacted groups, and followed by people of color. So I just wanted to note that difference there. All right, next slide. Same question, best use of ARPA funds within the equity focused services. What's really interesting about these results is that all the examples we shared were pretty evenly selected. And again, respondents could select all of them. And for this question, it feels like they almost did. 58% selected addressing health disparities and social determinants of health. 55% selected addressing educational disparities. 52% selected invested in housing, and 45% selected promoting healthy childhood environments. These evenly selected responses could indicate that respondents feel that all of these investments under this category are important to move toward an equitable recovery in our community. Among the key impacted groups here at the bottom, lower household income respondents selected each of these investments more than any other key impacted group. So basically, if you notice, the yellow bar is generally the highest in every example here. So they are at higher percentages selecting all of these. But still, if you even look at the other key impacted groups, the story is pretty similar. These are very evenly selected. Next slide. All right, so this is same question for addressing negative economic impacts. And you'll see that the distribution here is a little bit different. The top response across all groups was assistance to households, workers, and families. So that would include food assistance, rent, mortgage, utility assistance, cash assistance. I would say, except for essential workers, every other key impacted group chose this first one as their top, and essential workers chose the rehiring of the public sector, which is not surprising. They're an impacted group for that particular sector. The second response was supporting small businesses and nonprofits. That was chosen 56% of respondents. And again, just essential workers were the most likely to select the rehiring of public sector workers. And that's also likely driven by the fact that this is their sector. They may also be overworked and overwhelmed with the shortage of employees. Next slide. Premium pay for essential workers. The majority of respondents selected. So what we did for this category is, because it was pretty sort of cut and dry, it's premium pay for essential workers. The options that we gave was, would you prioritize pay to low and moderate income workers, all types of essential workers, other essential workers, such as grocery and food services, education, sanitation, transit, and then premium pay to healthcare workers. And overwhelmingly, the top response was prioritizing premium pay to low and moderate income workers. And then I would just say, notably, essential workers, that category, they responded in higher percentages to provide premium pay to all essential workers rather than prioritizing some. Okay. And the last data slide is investments in water, sewer, and broadband. So in this category, improving broadband access to unserved or underserved households was the top performer across all groups. While this eligible use category ranked last, so it ranked number 5, this alignment indicates that this choice would be the type of investment that would likely get limited pushback within this category. So there's high alignment here, or strong alignment. And then next slide. This one was just a question that we were really interested in asking, which was to get a better understanding of how much the community engagement effort in this survey helped respondents learn about ARPA and the funding. And so we just asked, how much did they know about this before taking the survey? And I think the one outlier is that 29% had knowledge of ARPA, had knowledge that Brookline would be receiving funding, and had a good understanding of the details. All the other bars, so 47, 15, and 10, had either some understanding or limited understanding. And so for us, that meant that over 70% of respondents were able to learn more about ARPA and Brookline by certainly the community engagement process, but more specifically this survey. Okay, next slide. And Heather, I just have one more slide, and it's the recommendations for investments. And the first thing I want to share is, our shared goal was to help build knowledge and understanding about ARPA funding in our community, but more importantly, listen to the community's ideas for building a more equitable recovery. So based on community member input via the listening sessions, the focus groups, and the data from the survey, here is our list, BCF list of recommendations. Next slide. It's dense, so I'm not going to spend too much time here, but I do want to give an overview because I think these are important. I think, the analysis is not a perfect science. When creating this table of recommendations, we took into account the survey, the quantity of qualitative data that we have, certainly the survey, which is statistically significant and reliable. And I sort of listed them in order of what to me should be prioritized based on what I heard, what I read and what I saw in the data regarding the investments that community members felt would be the best use of ARPA funds. So just the broad framing around this is that our community is very concerned about supporting the public health response. So we're living in a time when all aspects of our daily lives will be upended and have been upended because of public health emergency. And so, especially for vulnerable populations. Also, our community members are concerned about providing equity-focused services for people disproportionately impacted, as well as to responding to the economic harm that families, workers, small businesses, and nonprofits have faced throughout the last 2 years. And so these are it: investing in our public health response and in our public health department, crisis intervention services to support key impacted groups, assistance to household workers and families of key impacted groups to alleviate poverty, addressing the conditions that impact health and wellness and our quality of life, so social determinants of health investments, addressing educational disparities of key impacted groups, investing in housing, promoting healthy childhood environments, providing supports for nonprofits and small businesses, premium pay to low and moderate income workers, and improving broadband access and technology training to underserved households and key impacted groups. There's a lot more that's behind these prioritization areas for investment, but this is what we have. Oh, I misled. Sorry. One more slide. And I think it's just fitting to end with this. Next slide. I just felt like I wanted to elevate and finish with some of the voices of our community. So just want maybe 30 seconds for you all to read a few of these. There's a lot more, but these are the ones that I dropped in here. And then whenever you're ready, I'm happy to take questions or discuss.
Thank you very much, Giselle. This was an incredible presentation. You presented a lot of information in a way that kept my attention, which is not always easy. And it was visual. I could actually digest it. I hope members of the public who are watching at home found it as insightful and as easy to digest as I did. Any comments, initial reactions, questions from other select board members? Maybe we can take this out of presentation mode, and we can always bring it back up if there are specific questions that are featured on any of the slides. So Raul first.
So first, thank you, Heather, and Giselle, thank you for your work on this. And I know the entire team that worked on this. This is just a tremendous body of work. The amount of time it took, the attention to detail, really reaching out and talking to communities that we know through other data have been most impacted by the pandemic, and also communities that even prior to the pandemic have been underinvested in. A couple things I wanted to say about this. Just one is, I mean, this is a great example of what we should be doing every year with our budget, and I think this is the direction that we're moving in. I mean, it's been wonderful to work with BCF, at least in my time, on really building up the safety net fund, which became so critical during especially the worst days of what we've been through for the last few years, and remains available to people with the support of the Brookline Center, standing up the racial equity grant fund with us as well, and now this. And the BCF I thought was a terrific organization before, but under your leadership has just become something else and honestly indispensable for us. And we just have such a good partnership going with y'all. I hope it continues forever. The as you said, I don't know, surprising isn't the right word, right? That we knew, a lot of this I think is maybe more reaffirming, what, this is the reason we have a Steps to Success organization, the reason we have a Brookline Teen Center, the reason we have a Brookline Center, a senior center, and so many other organizations that are working to support these communities. But really, as I saw that last slide of the priorities, that are the result of all the work that you did, it didn't strike me like anything there. I said, yes, like that sounds about right. This, especially for this pot of money, limited funds, of course, with the direction that we've gotten from the federal government, this sounds right in terms of where we make our investments. I do think that as I think more and more about the kinds of proposals we're going to be looking at, I think I go back to that other slide where it said, if at the end of this, what's possible, like that sort of visioning slide where people shared the kind of vision that they have for Brookline. I think that one got me a little emotional. And then the last one you just showed, talking about, the toll that this is all taken on people. I think for us, putting the human element first, and doing everything that we possibly can to alleviate human pain and suffering, which I think most folks in Brookline know exists in Brookline. I think a lot of people outside Brookline don't think of Brookline in that way. But past reports from the BCF and the existence of these other organizations provides evidence to the contrary, that there is human pain and suffering in Brookline, and that that we, I think, should use this money to alleviate that pain and suffering first and foremost, and then give people the resources they need to thrive beyond just living, and that we should do that with this money. But then also we should really be, I think, rethinking our budget and the way that we put those priorities that we've seen through this process top of mind as we go into our budget. We've already started talking about this. We've already made some investments in a social services liaison. I forget the title there, but directing our efforts there. And I'm really hopeful that we as a community can invest more and more resources in that space. So that's what's top of mind right now. I'm going to chew through this. I'm sure we'll get a copy of this presentation. We'll have an opportunity to sort of look through it again and make our notes, read the whole report, all of it. So I'm very excited to get that and work our way through it. But thank you for the time you've taken to put this all together.
Thank you. And let me just respond to just two quick things. One, it was, certainly reading people's direct, because we took direct quotes. We don't have it attributed to anyone, but we have a lot of direct quotes, and reading that is painful. It's just really painful, and it really does put the sort of the human element that people are suffering, and they're suffering deeply. And the second thing that I want to share is throughout this, and certainly towards the end of the process, it became really clear for the BCF team and for me that this information goes far beyond ARPA, right? Yes, we can use this for making ARPA decisions, or you can use this to make ARPA decisions, but we, BCF, and any other community group or organization can use this as sort of the data that we need to really think about how we're investing our resources, our programs, what we're doing. And so certainly BCF, we intend to use this data to think about our own investments in the community.
Thank you.
Miriam.
So first, I'm going to apologize for the music in the background. For those of you who don't know, I have 2 teenagers, and one of them, this is her having her music down. I already asked. So one of the things that really struck me, so first of all, I have to agree with Raul. Thank you so much. It's really so helpful. There's so many places we could go, and I think what we really need to do is go where the community and the data tell us where to go, right? So the bumpers for the bowling lane, that's what this is. And I think it's highly valuable in that sense. The analogy for the bowling lane, however, fails when I look at those 10 things, and I tend to think into intersections, right? There's so many intersections. So you have this top priority for educational equity, and yet down at number 10, which is still a priority, don't get me wrong, but at number 10 is broadband, right? But you can't have educational equity and without broadband. So I feel like it's just important for us to consider these intersections. And when we are looking at proposals, we need to think about how this proposal A addresses more than one. To me, I'm going to be looking at proposals and how they cross-sectionally address these concerns. And so I think that's just something it's helpful, I think, to say okay. And the other thing I think that's really going to be tricky for us, and you already pointed it out, is there's some confounding in the data with the fact that the survey was taken during the height of the Omicron variant. And so how those top two priorities play out as we do long-term planning, I think we have to take them with a little bit of a grain of salt. We still have to do public health. We have to raise up the bar for our public health preparedness. And I'll say I'm very excited. We have a new director of public health who I think has a real strength there to do that. But that transitions more, instead of a response, I think, to a preparedness lens. And so I just think that's something, even though that's elevated to the top, it's confounded data. And so I would, it makes it a little more gray.
Yeah, I would say our consultant, kept telling us that this is when we fielded the data, and, timing and what's happening around us matters to how people respond.
Yep. Thank you. John?
Thank you. So a couple of things I just wanted to, observations, if you will. The first one is that I hope everyone will keep in mind that these are one-time only funds. So it's a large amount of money, $45+ million, but it's one-time only, and it's spread out over 3 years. And one of the guiding lights to this process, it's not an absolute requirement, but a guiding light to this process should be that we not use the money on needs, or excuse me, we not commit the money to long-term spending, because it won't be there after we've spent the initial amount. It's not like we're going to get 45 million again when this 3 years is up. At least as far as I know, we're not. So I think all of the things that have been enumerated in this very good presentation need to be weighed, in part by that standard. How do we spend one-time only funds in a way that has permanent impact and makes permanent improvement, but not slide into thinking, we'll add a lot of people to various budgets without regard to how we're going to pay for those positions 3 years from now. That's number one. Number two is that I think a process of this nature, as excellent as it has been, there's certain things it can't capture. And the one I'm going to focus on is the potential to spur economic activity that then itself has long-term spin-off revenue benefits. If we can improve the health of our commercial sector at a time when it is really badly beaten down and bruised by the COVID experience, and bring it back fully to life, and even better, bring it back stronger than ever, then that actually has revenue benefits to us over the long term. So the two things I mentioned are kind of opposite sides of the coin. One is you've got to be careful not to spend on obligations that are going to continue into the future after you've run out of the money. And the other is you should try to spend the the money as much as you can on purposes that will yield long-term benefits in terms of increased revenues, enhanced revenues, to fund those very things that require permanent long-term funding. So that's just two observations.
Great. Any other comments from select board members? Bernard, you have to unmute.
How did I get muted?
I've
Devin?
instructed Devin to mute anyone who
Yeah.
is not talking.
Okay, so what was I saying? I generally agree with John. But there's some expenditures that will be short-term and that will really force us to come up with the resources down the line in order to continue. And I'm thinking specifically of, and maybe this can't really be addressed with money, but the educational gaps that exist in our school system between children of color and other children. And what really I find outrageous is that this is across the income lines. That is to say that middle-class Black families or children have that gap just like poor Black children. And that's something that is kind of an outrage. And maybe we need to spend money now that we won't have in 2 or 3 years, but that we must find in one way or another to continue, because that's the type of problem that if we don't deal with it, we're going to have much bigger problems, much more expensive problems down the line. So, with that, my 2 cents on that little issue.
John, your hand is up. Did you mean for it? No? Okay. Miriam?
Yeah. So actually, I just want to riff a little bit on what Bernard just said in terms of the opportunity gap in our in our schools, which is something we also need to think about, which is we may not actually have the answers for what, I don't know that we know how to fix that, frankly. I don't think we fully understand how that gap or why that gap is the way it is. And so maybe we have to think of long-term in the sense of some of this money needs to go into figuring that out. I don't know the answer to that. I'm just saying that some of these things we don't actually know the answer to. We know there's a problem. Maybe, it's worthwhile to invest in digging deeper into what that problem is. That should be something for us to consider as well.
Giselle?
Yeah, I just this made me, Bernard, your comment, and Miriam, your comment too, made me think about one of the language in the guidelines around equity focused services, when you're really looking at key impacted groups who have been disproportionately groups who have been disproportionately impacted that already were impacted before, right? So these are exacerbated inequities, and take education, for example. So the language also says for equity focused services that in recognition of these disproportionate impacts in these groups, a broader range of services and programs are considered to be in response to the pandemic when provided to those groups. And so a lot of the guidelines, what they tell you is these impacts have to be a direct response of the pandemic. But when you're looking at impacted groups who have been disproportionately impacted, you can actually think of a broader range of services and programs to support those groups. So I thought that was a really interesting language that I think gives you and cities and towns the flexibility to think about how to invest in those groups. That it's just more flexibility.
Bernard?
Yeah, okay, I guess maybe it's not that I don't agree with you, Giselle, but I think that maybe there's a little more nuance here. What Miriam said is really key, and that is we don't know why some of these gaps exist. And maybe instead of services to groups, we need to service ourselves. In other words, develop the skills to figure out why these gaps exist. I mean, I find, I was on a school board in Ohio like 2 decades, 3 decades ago, a long time ago. And these issues were with us then. Apparently not as bad as we have here in Brookline for some strange reason, but this is an old problem and we haven't figured it out yet in terms of educational gaps between children of color and other children. So clearly there's something going on in terms of our own capacity to understand the problem that maybe we need to figure out a way of fixing. If that makes any sense.
Well said, Bernard. Raul?
Yeah, thank you. Two things. One, just to, around the issue of sort of one time versus sort of recurring needs. I think we should see what comes our way, and we should keep an open mind. As Bernard said earlier, it might be that maybe that's generally a good rule, but there's occasions when maybe it doesn't make sense to follow that rule. So let's just keep an open mind. Giselle, I do have a question though. You mentioned that the survey was available to people in multiple languages. Do we have I'm wondering how many people filled out the survey in a language other than English, and whether or not it was a sufficient number to be able to break out data by folks that filled out the survey that way. And also, I don't know if we asked this time around, but just the thought for next time around is trying to capture, if we can, whether people are, if they are, first or second or generation immigrants, might be helpful also to think about what kind of responses we're getting there. We've been doing a lot of work around language access, and we've got the immigrant advancement community for the Commission for Diversity and Inclusion Community Relations. So as we, I guess maybe for anybody listening out there, as we start doing more and more surveys of our community and, trying to capture that perspective could be helpful too. But anything you wanted to say on that?
I would say we did not have that many people complete the survey in other languages. And I think that's more to do with our reach doing an online survey. So it wasn't a survey that we provided in print. We didn't go around town distributing the survey. And so our reach, I think this is more about our reach rather than folks in the community who actually would potentially want to respond to a survey like this. I think I want to say 5 people responded in other languages. And that was also the first time that we as a foundation did something like that. So I don't know, I want to think through things that we could do better.
And that may start to change as we, our departments roll out our language access plans, and we're making greater investments in that space. So that's great. Thank you.
So I just want to acknowledge someone who I think is trying to get our attention in the Q&A by saying that childcare is a real problem. It was an affordability problem before COVID, and now it's even worse. And as variants come online and the doors shut on certain businesses, daycares sometimes close, and working parents have to figure it out on the fly, and that certainly is putting pressure on working women, working single parents, and just working parents in general that may or may not have a flexible schedule. I think schedules have gotten a little more flexible, in part due to COVID, but there are still a number of people that physically have to show up for work. And those people tend to be on the lighter side of the salary scale. The other thing that I wanted to react to, especially with the demographics that were presented from the survey, and then the last slide, I'm going to try not to get emotional. I suffer from depression, and it comes and goes. And when it is at its absolute worst, it is like kind of being like trapped underwater and being so confused about which way is up, because if you've ever actually submerged yourself and looked up, it's a mirror. So you can actually get very disoriented about which way is up. And it's really counterintuitive that when you're at the bottom of a depression, you forget to reach out. Like that's when you want people, but you just somehow forget to reach out to people. And it's we don't really understand, the impact that all of this is going to have on all of us, and especially the kids that are so isolated. But we're all isolated together. And I don't know whether or not that makes me feel better or worse. But maybe over the next year, I'm going to try to figure out how we can come together as a community so that I don't panic when my roommates decide to shelter in place in different states and I am all by myself in an apartment for the first time in close to 40 years for 3 straight months and cry myself to sleep. John.
Well, before I say anything else, Heather, I want to thank you for that. That's a message that needs to be heard, and it takes courage to deliver it. And thank you very much. And now what I'm going to say is going to sound very trivial by comparison, but I'm thinking back to I'm thinking back to Giselle's comment, which I think was a very important one, about how she was surprised that this process that she led with much help and broad support was novel. It's not something we do routinely. It's not something that's kind of baked into our current governmental processes. And I wanted to first of all agree with her, and I think one of the things that was so refreshing about what we observed in this process was that it was new. We weren't used to it. Maybe we had done something like this before, but nothing quite like this. And yet at the same time, I just want to sort of explain a little bit as to maybe why we have it, and in the interest of some self-examination as to our form of government. I think one of the reasons why we haven't is that we don't always have the opportunity to do wish lists for $45 million, in money, that windfall, basically. We're usually faced with, we don't have any money left over, and we don't even have enough to just continue ongoing operations. So what's the point of a wish list, And so I think the ongoing situation that we've had for many years now, with our particular financial situation, is it tends to mute this kind of process and this kind of survey and this kind of examination of, if we had $45 million, what would we do? Because we tend not to have $45 million to spend. So that's something also to keep in mind. And the other thing to keep in mind, I've been wanting to say this lately on the subject of engagement, which, I've made myself known for having some skepticism in certain aspects of engagement. And what does it mean to do engagement? And, is engagement a process, or is it, like breathing? Is it something we should be doing every day? And the message I've wanted to deliver is that with a town meeting form of government, and this is a message to all town meeting members out there, all 260 of you, soon to be, I think, maybe more than 260. Yeah, somebody can do the math for me. You are Brookline's engagement process. There's 15 of you in every one of Brookline's 17 precincts. That's a lot of people out there who could be playing the part of representing interests of constituencies, precinct by precinct, neighborhood by neighborhood, South Brookline, North Brookline, you name it. And most, for the most part, that's what town meeting members do. But I don't think I think we slid into a situation in which maybe they're not doing enough of it. And people are not turning to them to kind of represent the grassroots interests of the town. I hope, because I'm a believer in the town meeting form of government, that we revive somewhat the closeness of town meeting members to the people on the ground in their precincts, and the use of town meeting members to speak for the many, many interests of their constituents in their precincts. Because there's a lot of them, and all of them pulling together could really, really do the job of helping all of these needs and interests bubble up and become apparent on a regular basis. So that's that message, and I thank everybody for giving me the time to deliver it.
There was a very good point made in the Q&A by Rob Daves. I'd encourage select board members to pull it up and just kind of chew on it for a little bit. I'll read it in a second, but hands are raised. So let's go next to Raul.
Yeah. Thank you. Thanks, Heather, and thanks for your share. That was a big share, and I just wanted to say I appreciate that. And this is probably like the most emotional I've been in a while in a select board meeting. Is sort of thinking through this together and having this kind of conversation. I appreciate all of my colleagues for their contributions to it. You know, what strikes me is this: is here we are having a conversation around $43 million of one-time use. And what strikes me is as I see all of these issues in our community, the pain and suffering, and the need to invest in communities that have long been underinvested in, the wealth exists in Brookline to do it. Our ability to capture that wealth has been hampered in a number of ways by policy. Which had about $43 million right here. A couple of years ago, town meeting passed a real estate transfer fee, which would take a very small percentage of a fee when property, high value property is sold, to put it toward some of the needs that we've identified here, including the creation and preservation of affordable housing. If that would have been approved by the state legislature after we passed it, we would have $35 million right now just to put to that one problem. The money exists in Brookline to solve the problems that we have in Brookline. It's our inability to capture those funds, and so there are things that are happening right now. You know, the wealth tax, increasing the Raise Up Massachusetts and supporting that effort. But locally, I really have become more and more convinced that we need to really think about what the true cost of addressing these issues is, because it's not going to be captured in whatever proposals we do or don't get, because there are issues that have been brought to light through this community process, and we may not see any proposals that address those issues. So really understanding what the true cost of addressing, more optimistically solving these problems is, and wrapping it into an override, and really pushing for our community to say, we have among us the ability to support our neighbors in the ways that we know they need it, and it is just unconscionable that we're not doing enough individually to support this effort. And so I hope folks will keep an open mind about that as we figure out the true cost of the need in Brookline, and what we need to do to solve it.
Miriam?
Thank you. Sorry. So I just have to respectfully say that I disagree with the comments in terms of community engagement. We don't do a good job. And this is an opportunity for us to sit back and say, know better, do better, and to listen and say, the community wants us to do a better job. And we as elected representatives need to do a better job. So I would love to see one of the impacts from this work be a more robust community engagement process the town has that is more regularly leveraged. We don't have to reinvent the wheel every time. Now we have our foot in the door. We have systems that establish that we can follow and build a deeper path. And so I think it's important we do that. I mean, we should have done a better job there. That's fine. We didn't. I mean, it's not fine. We didn't. But this is an opportunity for us to say, okay, we hear you. And moving forward, we are going to try to continue to build on this experience, which has been a very positive experience and has been really important at elevating voices that we don't normally hear. So I just think that we can't dismiss that.
Before I call on Bernard, I just want to make a point that, it does kind of feel like when somebody drops to the ground and somebody else yells out, somebody call 911, and nobody does it. Because when there is like not a clear person in charge, like we have in the case of Brookline, where a lot of us are volunteers and we do this in addition to other things, and there are just so many of us, the responsibility somehow is very diffuse, and therefore, do we do a good job? I I don't know. Some people think we do, some people think we don't. Bernard.
A couple of points. First of all, not responding to, just adding something to what Raul said. There's a cost of doing this. There's also a cost of not doing it. And that's something to keep in mind. But on the other side, the cost of spending the money to not do it, if that makes any sense, is something that we have to understand has different impacts on different people. The other day I spoke to a group of seniors, and one of the issues they're concerned about is the fact that when people talk about overrides, they don't really think about the impact that has on a certain group of people, particularly seniors who are house rich but income poor. So I just throw that out as something that we have to always keep on our mind as we talk about these things. The other thing I want to say, and it's just an observation, I'd like Giselle to give her thoughts on this. In one of your slides, you indicate that the percentage of respondents who were renters were 22%, and whatever the reverse of that is, were homeowners. And that's very interesting because in Brookline, my understanding, based on statistics from the Brookline Community Foundation, more than 50% of our residents are renters. So that's a sign that we're missing a huge portion of our population in this survey, but also in other things that we do. There's a reason why we're missing those people, because many of them are transitory. Many of them are not as leisurely as some of us are, and really have to spend their time working, struggling to keep their family fed and organized and all that other stuff. But it's something that we should always, we shouldn't overlook it when we do in community engagement. I'm not sure I'm not sure that there's an easy answer, but it's an obvious issue that we have to work on.
So Giselle, before I call on you, I did indicate that I would actually read what Rob Daves shared in the Q&A. So I want to do that now before I totally forget. This is far-reaching data. The community as a whole needs to hear these voices because they bring out issues that need ongoing discussion. This is work, and this presentation has been wonderful, but what plans does the SB, meaning the Select Board, have to get more people to see this information in order to encourage engagement with the Select Board as decisions are made? Good question. Also, thank you for those that have reached out to me to show their support for the comments that I made earlier. Giselle.
I think, Bernard, what really struck me in your comment around there's a cost to do this work and a cost to not do this work. And I think, I had a board meeting for the foundation. I don't know if it was last week. The days have been long. But I think one of the questions that one of our board members asked me is, because I was sharing, there was a cost to do this work, and not like financial cost, just the toll of doing the work for our team actually meant that there are things that we just did not do because we were doing this engagement work, and the trade-offs that we had to make to be able to do this and do it as well as we could, even though I think we could do better still. And so there is a cost to do it, but my response was, I just reading the comments and listening to people tell us and other partners what they were experiencing, and not only what they were experiencing, but here's how you can solve for that. Here are, ideas for the community to do better. That's worth it. But I just want to stress the cost is great. In terms of, I think, whether it's the town's ability to do the work or other people's ability to do the work. I definitely feel like now, having been through it, how could we not have done this work? Because it's so far reaching, as Rob mentioned. But I also don't want to minimize just the effort it takes, the diligent, consistent effort it takes. And to the point around the renters versus owners, that's our sampling and the respondents who we engaged. And I think when, we or others do this kind of similar work, how can we get those demographics as close to our town's demographics as possible to really sort of feel like it's representative, right? And so we're missing, even in this, we're missing perspective. But I think this gives us a good baseline and baseline data to figure out where are the places where we need to increase that engagement, because we're not getting that perspective.
It's a lot to take in. Bernard?
Yeah, I guess I'd be remiss if I didn't say that I also appreciate what you said from your heart earlier, Heather. And I was thinking about how I think we all suffer different forms of I don't know if you call it depression or what, but different forms of discombobulation because of this pandemic. And there's nothing wrong with that, and we'll get over it. But it's difficult. I mean, it's really difficult. So just want to let you know that I also appreciate your comments. So.
Oh, thank you. So I want to focus on what we're going to do with this information, because part of the community engagement process is you reach out and you get the comments, and then if you don't do anything with those comments, they're probably not going to share again, because people want to feel like you heard and you acted on it. So there are proposals that have been submitted. We are going to have a process, and Mel just raised his hand, so I will let him go into a little bit more depth.
Well, thank you, Heather. I also wanted to say a great appreciation to the Brookline Community Foundation and Giselle Puigbo for her efforts and her leadership. We do a lot of public work. All of our meetings are public. The select board has public comment every week. There's a lot of engagement at our town meeting, but I think it's fair to say that we don't know very well how to get the people who don't otherwise want to speak up. That's always our challenge. There's a lot of people who want to speak, but we have the challenge of listening to everyone, and that's what we're so grateful to the Brookline Community Foundation for helping us do. I also wanted to mention, as you said, Heather, as we look towards next steps, that there is another facet of BCF's work, and that is to do some technical assistance. We thought that was really important as we identify these issues, that we also provide those who don't have the capacity to develop proposals as well as others to have that technical assistance. So I did want to say that to Giselle. My thought, Heather and members of the board, is that we need to just think about this data a little bit more, and the information. I would value to have some sort of level of engage discussion and perhaps some preliminary priorities that the board might think about before we start diving into specific proposals. But I'm open to discussions there. Melissa, what was our overall plan that we've developed that what would be the next steps, at least when we first started this process?
Sure. So I think we were envisioning that in your budget message, you'd be, reacting to Giselle's report, talking a little bit about some of the municipal needs that we weren't able to fund through the budget process. We're having town school partnership on Friday to continue talking about their needs and the revenue replacement category. But then also kind of using that existing budget process as a way to start airing the project proposals. So, kind of as a department is talking about their budget in front of the board, they're also talking about the requests that they have in the portal. And then also, once we get, we do have some community requests, but, the predominant requests that we have currently are departmental. So, once kind of people see how departments make their proposals, then we'd have to, have some space for the community proposals to also go in front of the board. And then, we would also need the board to kind of talk about the prioritization and, whether or not they're looking for, staff recommendations around some of these proposals as well.
Miriam?
Yeah, I have a question. So I thought that the departmental proposals and the community proposals would be presented together. But it sounds like the way that you described it, the department proposals will come first, and then the community proposals will follow. Am
Well,
I
I
just
think-
misunderstanding?
I think the department heads are probably more prepared to make a presentation to the board than a community group might be. If there is a community group that would be ready, I think we can put them on the same night. BHA has proposals. Michael has come here and, done presentations. So, I think there's a way that we can make them at the same time. But I think taking advantage of the budget schedule where we have regular visits from department heads and making sure that, we don't have to have them coming back twice to talk about their budget in one night and ARPA on the second night is really kind of, what I was thinking about.
Raul?
Thank you.
Yeah, thanks for explaining that a little bit. Yeah, and I want folks to know a couple things. One, we haven't seen any proposals yet, unless some other board member has seen proposals. I haven't seen any proposals yet. Maybe I should speak for myself. And so there's not proposals that are available to us that aren't available to you yet. I do think and that we need to provide maximum transparency, and whatever it is that we see, the public needs to see. Because we need to be held accountable for the decisions that we make, and not on a one-off basis, or but really as a whole. It also and certainly with enough time before we make any decisions, because to my point earlier, there may be members of the public after seeing this presentation, and let's get this video out there so people can watch it and watch our discussion about it. But after seeing this presentation, might be able to look at the list of proposals and see some really big gaps, right? Now, any one of us might not be in a really good position to submit a proposal to fill that gap. Let's say it was around mental health resources, but there are organizations and folks in Brookline that would. And so I just want to make sure that there's a space and opportunity for people to have watched this presentation, to look at what proposals have been submitted, and then have enough time to be able to submit their own proposals to sort of to hit the gaps that issues we've identified as priorities, but maybe that we don't have really sufficient proposals to meet. And then the last thing I just want to say is that certainly in my mind, town departments don't have any more of a leg up than proposals coming from the community. And so whatever way we decide is best administratively to look at proposals, You know, I certainly don't think that I'm not thinking about let's look at what town departments need and let's see what's remaining for community members. I think we're looking at this more holistically, and I see heads nodding. So yeah, I just want folks to know that too, just before they think we're gonna, you know, really it's just a few $1 million and the rest of it's all going to the town. You know, this is really intended, and as Mel mentioned, the process with BCF, the technical assistance, all of that is intended not just for show, but to actually, you know, make space for the community to have meaningful input, but also involvement in the process too.
Miriam?
Just to piggyback on that, you know, we are going to have kind of a checklist that has an equity lens on it. And so John and I are going to be working with Mel and a few members of the community who have really helped to develop, and Melissa and Mel have already developed an internal checklist. We're going to kind of try to bring it all together as something that really we can measure proposals up against, so that we can say, look, we have a criteria of what has been identified through this robust process of what is important, and these proposals line up or don't line up with these criteria. And that should help us kind of elevate proposals that, as I alluded to right at the very beginning, that to me hit an intersection of multiple desires, right? A proposal that can address 3 or 4 of the top priorities is going to, I think, be elevated versus one that's not, right? And so I think we need those processes. And what's nice about having these criteria is, as Raul said, it adds to the transparency. So people can look at that proposal themselves and say, I, you know, see how they met these particular criteria and why this was chosen to be funded. They may not agree, but but at least they can, right? You know, not everyone's going to be happy with everything. That's clear for sure, no matter what. But I think that by making this, you know, Melissa and Mel have done a lot of background work already, you know, melding that with the work that's been done by Giselle and her group. That is what brings us to a process that you may not necessarily agree with, but at least you understand how we got from A to B.
Yeah, I will be taking the next week to digest this and to try to figure out how do we really set up a process that will hopefully be successful, but is also kind of fluid and flexible, that allows the select board to feel good about the decisions that are made, considering that the 5 of us are volunteers and there are 5 of us. I mean, at least there are not 9 of us, but there are still 5 of us with our own thoughts and priorities. So for better or worse, we need to work together. And I'm very excited to see these proposals and to get to work, but it is going to be a lot of work, and hopefully the public will be patient, but also benefit from the hard work of people submitting the proposals, and then our staff, and hopefully the 5 of us trying to figure out how do we spend this money. Raul, do you mind if I call on Melissa first? Okay,
Melissa first, please.
No, I just want to, you know, this is a multi-year grant, so it may feel overwhelming right now because we're at the beginning, but this is not the end of the engagement process. And, you know, we're going to be having multiple opportunities to, you know, get additional feedback after requests are presented. We're required to have a public hearing. You know, there'll be, you know, I'm sure there'll be newer needs that emerge that we may need to respond to as well. So, you know, this is just the beginning.
Also, I would be remiss if I did not bring up a question posed by Bonnie Bastian in the Q&A. Do we have deadlines for proposals? It's kind of a rolling basis. Okay. Raul.
That's all I was going to do is draw your attention to that. I'll say there's one other comment which I won't read, but I'll say if there are others out there that that feel like they missed the opportunity to provide input through through this process, please send a note to the board. Let us know like what you think we should be focusing on. You know, what areas. I'm not, you know, and really what I mean is, you know, not necessarily constituencies gathering together and that kind of thing, although I'm sure that'll happen. But I really mean just individual folks in Brookline that want to draw our attention to issues. You know, Heather mentioned childcare as one, and that's certainly one that we've heard from a lot of individuals in Brookline about problems accessing and affording childcare. If there are other things like that, like don't hesitate to send a note to the board. You can send it to, what is it, selectboard@brooklinema.gov, and that gets shared with all of the select board members all at once. So so please feel free to do that.
Yeah, I just put that in the chat. Giselle?
Yeah, I was going to share around the technical assistance support. So obviously was not part of this presentation. I think we're considering that sort of two different, you know, community engagement and then technical assistance. Just to share out with you all, we've been doing technical assistance since the second week of January. So specifically, I spend my Fridays doing 30-minute sessions with community members who have signed up. So some of them are part of nonprofit groups. Some of them are just individuals in the community that want to think through an idea, thought partnership. In some cases, I look at proposals, share my own thoughts on sort of proposal development and what you would want to include, especially because I think the application and the platform is really sort of bare. It doesn't ask for that many questions or that much information or too much information. So I've been sort of assisting folks, again, these are optional, who've signed up for these, and just giving them my own guidance and recommendation as to what they should be, what type of information they should be sharing. So all to say, Mel, that has been happening and it will continue to happen through I think the next 2 weeks. And because I think there are some unknowns in the process, even for myself, you know, no deadline. I've been, you know, people ask me questions during those sessions, and to the best of my knowledge, I answer. And so I tell community members who are interested, submit your proposals. I think the select board will be reviewing in February. I don't know hard deadlines, but so I think we're doing our best as a community to sort of go through the proposal development process, at least folks who I've engaged with, without knowing a lot of detail around what's expected from a community proposal, what you all are looking for. And again, hopefully this report helps, but if there were any kind of information that in the coming weeks you all can discuss, align on, and share out around either priorities or deadlines, I think it's just helpful.
Mama, ya terminaste.
Sí, ya voy a terminar.
Yes,
I'm done. I'm
Hi.
done.
Hi.
Bye.
Somebody wants their room back.
You almost made it, Giselle. But I think Giselle's right. You know, this is a new process for us. It's brand new. We've never done this before. And so, you know, we're learning as we go along. I think this process that Chair Hamilton talked about, bringing a couple of board members together with staff to try to maybe put some parameters around the process would be useful.
Right. Thank you so much, Giselle. This is part one of a series of conversations that we will continue to have.
Thank you, everyone. Really, thank you so much.
Well done. Thank you.